Welcome to our latest edition of 12 Health. I'm Shannon Hegy, and today we are talking to Bob Cooper, CEO of Smoltap. It is a positioning stabilizer for infant spinal taps. So, Bob, thank you so much for being with us. And this device was actually created by two local doctors.
That's right. Out of Brown University Hasbro Children's Hospital, Dr. Alverson and Dr. Ravi DeCruz.
So tell us where this all came from. I think you said this process started back in 2019.
That's right. So in about 1890, a doctor discovered that meningitis can be analyzed through spinal fluid. And since that period of time, they've been holding babies on their sides, taking their head and their face and smushing in between their knees. They've been doing it since that period of time. Well, right around 2019, Dr. Alverson was in a treatment room trying to test a baby for spinal meningitis, and stuck a needle. What they do is they actually take a needle and they put it in between L3 and L4 vertebrae to pull spinal fluid out to have it sent off to the lab to be tested to make sure if the baby has spinal meningitis or not. So in 2019, Dr. Alverson was trying to get a tap on this baby, and he tried 3-4 times and couldn't get it, was incredibly frustrated. There's a lot of variability that exists because different nurses hold differently, different techniques. Some babies are wiggling around and kicking and screaming, sometimes throwing up and decompensating. So it's a very difficult procedure, and it fails about 50% of the time. And he couldn't get the spinal fluid from this baby. Walked out in the hallway and ran into Dr. Ravi DeCruz, incredibly frustrated. Ravi DeCruz was actually an architect before becoming a doctor. And the two of them were talking in the hallway. Ravi asked Dr. Alverson if he had any ideas for a class he was teaching at Rhode Island School of Design. And he said, boy, do I have an idea. And they decided right then and there that they were going to work on this project together to develop a chair to hold babies in the proper position repeatably and be able to improve the experience all around. And so they worked with New England Medical Innovation Center and Dan Nelson at Nelson Product Development to come up with a device to hold the baby in the proper position.
You know, you think of a medical device, and when we think of, a newly invented medical device, you think of something really complicated. When you look at this, it's not a complicated device, but it's a device that makes a complicated procedure much simpler for doctors.
That's right.
Can you explain to us how it works? You actually brought it with you, right?
I did. Today, what ends up happening is a baby who has a fever comes into the emergency department, and they have to do a full workup on them. One of the things they have to do is actually test the spinal fluid for meningitis. So they place the baby on their side generally and take their face and press the baby's face in between their knees to open up the space between the vertebrae. Well, that's incredibly complicated because the baby is kicking and screaming and throwing up and doing all sorts of things and resisting that. And so there's all sorts of variability that exists with having different nurses holding or different positions, et cetera. So what they realized was not only is lying down hard, but not having the baby stable and having all the variability creates over 50% failure rate. So they decided to work on a chair that looks like a little massage chair where you put the baby in, and it does three things. One, it has the baby sitting up, so spinal fluid actually goes down to the spinous cavity so they don't get a dry tap.
So it's actually better to have them in that position
It's better
versus
to
the lying down.
Sitting, that's right. And then secondarily, the chair, this is the spinal tap device. And actually what the seat does, it posteriorly tilts their pelvis. And so what that does, it actually takes the pelvis on the baby and it tips it, and that opens the space between the vertebrae, and then the baby is tilted forward. And the other thing it does is because the baby is sitting in this device, it actually holds him in this very stable position using some very soft straps, holds him in this really nice position. So they're not wiggling all over the place and they're very stable. And we think they feel like they're being swaddled because generally they fall asleep when they're sitting in this chair. So the baby's in this great position. The pelvis is tilted. You can feed them sugar water sweeties. So they're quiet down. This is Cecilia, by the way. And it's in this great position. And we've gone from about a 45% success rate. And now in the 60 children's hospitals that we're in or around the country, we're up over 95% success rate. It's
Wow.
an I mean, that is an unheard of improvement.
I mean, I can't imagine that they came up with this prototype right off the bat. There must have been a lot of kind of create and then go back to the drawing board
Right.
and consulting with other doctors and seeing what worked. What was the process like?
Well, Dan Nelson and Nemec, working with the doctors, they came up with an initial design. They 3D printed it and went in and out of the clinic, and we're getting feedback. It took over 3 years to actually get this right. This is about model number 10.
How
version number
close
10.
to this model was that initial design?
The initial one was just wire. And so went from there. A lot of things have changed. For example, there's a floor that makes sure the baby doesn't push back. It's wider, so it's very stable. There's also these arm guards actually move up and down, so they slide up and down so that you can go from a newborn up to about 2 months.
Because I was going to say my next question is that meningitis, there's a wide range of children that need to be tested for it.
That's
So
right.
this device had to fit a lot of
From
different
newborn up to 2 months. So
bodies.
the AAP meningitis guideline is the first about 45 days of life. And so most of the testing is done within the first couple of months in babies around meningitis, especially bacterial meningitis.
You must see an impact not just in success rates, but also in the process itself. Because for the doctor, for the nurse, for the parents, for those who don't know, and we're going to get into this later, but meningitis is a very, very serious infection and needs to be treated very quickly to reduce complications.
That's right. Well, first of all, meningitis itself can actually kill a baby in 24 hours. It is incredibly dangerous. It's rare, but it's very dangerous. And that's why they test so many babies that come in with an undiagnosed fever. The process and procedure today, by a nurse holding the baby in what's called the C position decubitously, so lying on their side in this little scrunch position with the baby wiggling all over the place. And then you have a doctor who's leaning sideways to try to get a needle in between L3 and L4. And the baby's not happy about being squished in this position. They're wiggling. It is incredibly stressful for everyone involved, for the baby, for the nurse, for the doctor, and if the parents are in the room. It is described as awful, and it is an awful experience. And what this has done, I've been in dozens of these procedures now, and the change in the environment, it is so much calmer and so much more relaxed. And the fact is, we're getting a first stick in most babies at about 65%, where it used to be in the 30% rate.
Wow. I mean, and you think about that, if anybody, this isn't something that I think a lot of people can relate to, but if you've ever been in the hospital or a doctor's office with your kid and you see them not being able to find a vein, which is also difficult in children because their
Right.
veins are so little, having to watch a doctor or nurse stick them over and over and over again when the child's upset, the parents are visually upset. Now imagine it in your child's spine and how difficult that is.
It is awful to watch. And it's not just bad for the baby. I mean, can you imagine being a doctor that isn't getting the tap the first time and looking at the nurse or looking at the parents? I mean, what this does is it makes it so much easier because the baby's really stable. There's space between the vertebrae. And doctors invented this so doctors can improve their experience.
Yeah, that's huge. So let's go into, because again, I just don't think enough people understand the spinal tap. That's not a small needle either.
No, it's not. You actually have to go in several centimeters in order to get into the spinous cavity, to get the spinal fluid out of the spine and send this fluid off to the lab. Usually culture takes about 2 days to come back, whether it's positive or negative. And so they test for multiple things, white blood cell count and other things, to be able to make a decision on whether or not they need to start antibiotics, whether they need to be admitted, or whether you can send the baby home. But the process of lining up and getting a needle in between an incredibly small space between the vertebrae while the baby is moving, and in newborns, the skin moves all over the place. And if they're kicking and screaming and moving and throwing up and decompensating, the chances of getting that spinal fluid is very low. And so our mission is to make certain that no baby, no doctor, no nurse, no parent has to go through that procedure or process ever again.
Now, you have a video as part of your website that shows this actually being used on a young baby being positioned. The baby's very upset in the beginning.
Yep.
There's something about that position that really calms a baby versus being crunched in with their neck in between
That's right.
their knees.
Well, what ends up happening when the baby is on its side and their face is in between their knees, you can't give them things like sweeties, which is sugar water, which really calms the baby down. It almost acts like morphine without any side effects. It really just calms them down.
So it's really having access to their face because of
That's
the way
right.
it's...
The way it's designed, you can actually see, Cecilia's face and the opening. So it allows to do that. But they're also, because we have these arm guards that are raised, we're actually holding the baby in what we think feels almost like they're being swaddled. So they calm right down, and more often than not, they just fall asleep in the device. So it's very quiet and calm, and it's a much nicer process and procedure.
That's for everyone. All right, so in a little bit, we're going to be back after this break. And when we come back, for those of you out there who don't know, I have a personal experience with meningitis and with a spinal tap and had to watch one on my own son. So we're going to come back and talk about that, as well as the success rates Smoltap has seen and what hospitals it's currently in. We'll be right back with that. Smoltap, a position stabilizer. I'm never going to be able to say positioning stabilizer. How do you do it? For infant spinal taps. Now, before we took a break, I mentioned that I have personal experience with infant spinal taps, which is not something anybody should have personal experience with. But my son Carter, for those of you who don't know, was diagnosed with bacterial meningitis when he was only 2 months old. And you heard us talking about when an infant comes in with a fever. Carter was 2 months old. He had a 104 fever, I believe, and we were told to get to the ER immediately. And they knew, when we got there, between the fever, between a bulging fontanelle, which is the soft spot on the top of the infant's head, will be kind of elevated because there's swelling in the brain. And then immediately they told us they needed to do this spinal tap. I think you kind of push a lot of that to the back of your mind because it is so traumatizing. But when I went to go watch the promotional video for Smoltap, I had to...
Couldn't watch it.
I couldn't watch it.
Yeah.
And it's not even a full...
It's 2 minutes.
But that's how traumatizing it was for us. And what we didn't talk about before is that not only is the baby probably crying, the parents are nervous, the doctor is stressed out, but we were told, that because Carter was acting so weird before we kind of took his temperature and figured this out, that it's like the worst headache you can possibly imagine. So this baby is in pain and feeling horrendous. And then you have to go through this horrible procedure where you're sticking a very large needle in the baby's spine. Yeah. So that's just another reason why this device kind of takes so much of that trauma out of the procedure.
That's right.
We ended up getting the diagnosis that it was E. coli meningitis, which is I think the rarest and most serious of all. Yeah. So when I heard about this device, I thought, well, I'm glad another parent can at least have hopefully a less traumatic. And I think we only had one pass to clarify when we went to Hasbro Children's Hospital. They got it on the first time, but it was still traumatic even then.
Yeah, I'm sure. I mean, the data all shows today that, as I said earlier, the success rate is really about 45%. That's the published data across the country. And the challenge with that is 54.1% of those babies that they don't get a tap on end up getting admitted unnecessarily in the hospital. And that fires up an incredible amount of cost. So all of a sudden you've got a baby who's on antibiotics unnecessarily. They're taking up a bed unnecessarily. The hospital's probably not getting reimbursed from insurance because they don't have a diagnosis of meningitis at this point. So there's just this incredible amount of cost. What has happened now is not only were you improving the first stick rate up over 63%, but we're now showing that the non-traumatic, the non-bloody taps have now dropped 350% with this device based on Toronto Sick Kids data. So both that combination of things, and then the reduction in the resources. So now you don't need a nurse or 2 or 3 to hold a baby anymore. You can put the baby in this device, it looks like a little massage chair, and it holds the baby still, and you can use a tech or a nurse. So nurses have a very high training level, so their licensure is very high. And holding a baby is sort of the lowest level of their licensure. So
Right, to just make
it
sure you're
really,
calming the baby.
the cascade of cost that this device saves it's extraordinary.
Another nuance, again, if you've never had to deal with a spinal tap, a bloody versus a clear. Bloody would mean you
Right.
didn't access the
Traumatic,
spinal
right.
tap fluid, correct? Or it something went wrong with the tap where it's
Yes. So the nuance is if you try to insert the needle in between L3 and L4 and you nick a vein or something and going in, and all of a sudden there's blood in the spinal fluid. At that point in time, you've essentially crossed the blood-brain barrier, and you really don't know if there's bacteria in the blood, and all of a sudden now it's in the spinal fluid. You don't know where that bacteria or virus came from, and so it confounds the treatment, and it confuses, makes it hard for the doctors to make a decision because all of a sudden you don't have spinal fluid that you can trust.
Yeah. Can we get a little deeper? And I know we have so many things to talk about, but meningitis itself, again, for those who don't know, the infection of that spinal fluid.
Fluid in the brain. Well, it's a bacteria, and sometimes you have it in your body when you're born, and for some people it takes off, some it doesn't, or you can pick it up in the environment, and the way it spreads can actually kill a baby within
there's different
a day.
Bacteria.
Different bacteria,
So
different viruses,
And
all sorts
you
of,
need that spinal tap so that you know which
determine
antibiotic.
exactly what it is. That's right.
That's right. Okay, so let's talk about success rates because the first pass, as you said, success rates jumped from 41 to 63% with the Smoltap. You also saw that you were able to reduce the staff burden. You were able to reduce costs in hospitals. Any other things that you saw that you didn't expect the device to be able to have an impact on?
I think the biggest surprise is really the workflow speed. We didn't really, we understood that it was taking extra time, but all of a sudden when you're starting to have to put a needle in baby's back 3 or 4 times, the first stick, if you can get in the first stick, it's unlikely that you have blood in the CSF, in the spinal fluid, and you can send it down to the lab to get tested. If there's blood in it or you hit bone or something else happens, all of a sudden you have to pull out another needle. Sometimes you have to open up the baby, open them up from that C position so that you can then, the nurses can then hold again. And imagine being a nurse holding a baby for 45 minutes or an hour in almost like this isometric position. I've been in dozens of these procedures, and almost every time the nurse is, sweating, or their back hurts, or their wrists hurt if they've got carpal tunnel. It really is this. The surprise to me is how much quicker and simpler and smoother and calmer the procedure is. I mean, I expected to get better success rates, but I didn't expect the entire experience to change.
So we talked about the process of kind of coming up with the prototype and developing it in 10 different models. What happened after you finally came up with the right model? After that, it was kind of a matter of trying to get it into hospitals, right?
That's right. Selling into hospitals today is very difficult, and it requires, a doctor and nurses or the clinicians to, be enthusiastic about sort of changing their standard of care, going from sideline to sitting. It requires a value analysis committee to analyze, how much this costs compared to, nurses' hands holding the baby. It also requires, tests and trials to actually see if they'll, the doctors and nurses will be comfortable with it, and also safety and training, et cetera. So there's a very long process of procedure, but amazingly, in a very short period of time, about a couple of years, we're in over 60 children's hospitals across the country, and we have over 300 hospitals in the U.S. and Canada that are in the process of trying to buy one of these devices or looking to buy one of these devices. In New England alone, we have Maine General, Northern Lights, Mass General Hospital, Yale has just gone into trial. Boston Children's Hospital has it. The number 1 hospital in the country has it. South Coast, we love South Coast Hospital. And then Hasbro was invented. We're working with the incredible doctors now in the emergency department and the hospitalists and other departments at Hasbro. And we're also talking to Connecticut Children's. So in New England, it's starting to, sort of blossom across the whole New England marketplace.
Yeah, I assume it's got to be a tough sell. Again, it seems like such a simple device with such a wide.
It's like a no-brainer, right?
Range of What are you selling it for? If I'm allowed to ask.
The device actually sells for $2,500, and so we made sure that when we designed this, we took out some features to keep the price to the point where even a very small rural community hospital can afford this. And then the straps are single use, and they're $50 a pair.
Okay, so each time you have a different baby.
Yep. Because what you don't want to do, if a baby does have meningitis, you don't want to spread it to the next baby. Even if you clean it off, there's a risk. So you want to take clean, brand new straps and use those in each procedure.
Gotcha. And how long have these hospitals had the device, or most of them?
The first hospital is probably about 2 years, and the device lasts 2 or 3 years.
And when you go in, I mean, the conversations you're having with these doctors, because data is one thing, but when you talk to the doctors and you talk to the nurses, I mean, it must be rewarding to hear them. Oh,
it is amazing. So if this is up to nurses, it would be in every single hospital in the world because they're the holders generally.
Yeah,
so They really want to. They don't like nurses and pediatricians and people in the pediatric space don't go into this to do something they feel like is harming the baby. They just have this incredible persona about them. And all of a sudden you're taking a baby and you're smushing their face in between their knees, and the baby's kicking and screaming and decompensating or running out of oxygen. And you're having to hold that baby in that position while a needle's going in their back. And this has completely changed the dynamic of that. And the most important piece of this, and I've said it a couple of times already, the most important piece of this is the baby is very still and very stable, and they're able to get it on the first try most of the time.
Yeah. How often are they even seeing babies with meningitis? I mean, when you come in and you're a parent, like we were, and told this is super rare, and you're thinking, great.
Okay, great us.
So, I'm so glad that we got the rare, awful case of the thing that could kill our child. How often are they seeing babies come in with meningitis?
It depends on the hospital. So if you've got the big institutions like Boston Children and CHOP and Cincinnati Children's, CHLA, 300-400 times a year, till 30 times a month. The smaller hospitals will see, like a little community hospital, maybe 10 times a year.
Right. But you're thinking this is, I mean, when we walked in, we were in the ER of Hasbro Children's Hospital, and you've got a waiting room full of kids, so you can't be spending your time trying to get multiple spinal taps done on a child.
That's exactly right. The other thing that's really interesting that we found is, this is the other thing that surprised us. We expected this device to be applicable for the emergency department and the neonatal intensive care unit, or the NICU. Was your child in the NICU?
Yes.
Okay, so in the NICU.
Not NICU. I'm sorry. PICU.
In the PICU? Got it. So this device applies, they're using it in departments now. For example, CHOP uses it in multiple departments, as does Children's Hospital of Philadelphia, Cincinnati Children's. So they're using it in the emergency department, the NICU, the PICU, the pediatric ICU, operating rooms. They're using it in cancer centers, neurology centers. They're using it up on the floors in the wards.
And this is just not just for spinal taps?
And it is for, because they do spinal taps for babies across multiple departments. So one of the surprises, we thought it was going to be 2 departments. It turned out to be 10 or 15 departments across the hospital.
Wow. Well, I think it's really, really great that it was created by 2 local doctors that were seeing it in local hospitals. And again, as someone who's been through the unfortunate trauma of seeing their child go through a spinal tap, I'm so glad that some other parents might have the opportunity to have that experience be less traumatizing. By the way, if you do want to see Carter's story, that's up on WPRI.com. Bob Cooper, CEO of Smoltap, thank you so much for joining us on 12 Health.
Thank you very much. Appreciate it.